Hello, everyone. Welcome. My name is Taran Karunagore. I'm with the CMH team, and I work as a knowledge and research lead here at the center. Thank you for joining us here today for our webinar. I want you to look at the screen, the slide that I have shared here, to look at some of the things that we'll be doing. So closed captioning is available at the bottom of your screen if you'd like to use it. The chat function is there for you to discuss thoughts and reactions. The Q&A function is there for submitting questions. And Tyler has been really great to let me know that you're welcome to ask questions throughout the presentation, and he's happy to answer as they come. But then there will also be a question period at the end as well. This webinar is recorded and it will be available on our website at the end. So without further ado, I'm just going to turn it over to Tyler for introductions as well as the land acknowledgements. So over to you, Tyler.
Perfect. Thank you so much, Tarn. And thank you all for inviting me to be here. I'm excited about the presentation today. Before we begin, I just want to mention one thing. I am joining you from home today, and I have 3 dogs. They sometimes lose their minds when a car drives by or something. So I'll request patience in advance if they do disrupt the presentation. They mean well. I'm going to share screen, and then I'll introduce myself, and also I have a land acknowledgement within the presentation as well. Oh, there we go. Can you see that all right, Tarn?
Yep, it looks perfect.
Perfect. So my name's Tyler Twarowski. I'm a doctoral student through Queen's University doing PhD, and I'll be talking about some of my research today, but I'm also a director of service at Canadian Mental Health Association, Cochrane, Timiskaming. So I'm joining you today from Englehart, Ontario. It's near Kirkland Lake. And if you don't know either of those places, I'm 2 hours north of North Bay and 2 hours south of Timmins. The presentation I'm bringing to you today is called The Medicine Pouch in the Doctor's Bag, and it's an opportunity to have reciprocal mental health care approach in Canada. And I'm joining you today, and the work I'm doing is in the Treaty 9 territory, and the lands on which I live are the traditional territory of the Anishinaabe, Mushkegowit, Cree, Algonquin, and Métis peoples. And it's important to note that we are all treaty people. This compels us to understand our obligations to these communities and to work together towards reconciliation and true health equity. And I'm going to begin with a customary introduction as I was instructed, but I also request humble forgiveness. I'm not a Michif speaker, so if I do bungle the words, please, I'll request patience. Tanshi, Tyler, Dishkashun, and Michif Naya. Hello, my name is Tyler. I am Métis. Ni Uvrash Awa. This is my work. And I mentioned to you that I live and work in Northern Ontario, but I was born and raised in Saskatchewan. My people are the Legaries, Lapines, Bruces, and Pelons, and I have a proud and distinguished Métis ancestry, as many of my relatives were part of the provisional government of the Riel Rebellion or resistance. And many of my people come from the areas around Batoche. And today I'm going to talk to you about indigenizing mental health. That connects to both my work and my school of research. And the objectives that I'm hoping to see include reciprocity, respect, two-eyed seeing, resilience, and hope. And it's important because in this area that I work, there are a number of Indigenous communities, and many of them don't have effective access to mental health resources, and many of the communities are struggling. And I believe that we all benefit from healthy Indigenous communities. And I believe that all of us in this country would benefit from understanding Indigenous healing practices. to deepen my understanding and the area that I work in, and for my research, the research focus that I'm looking to do is to engage Indigenous communities near where I live and work to participate in healing circles. So I can engage as a form of community engagement to guide the work that I'm doing, to deepen understanding and to learn more directly from people, their thoughts and understanding and desires and priorities for mental health in the area. And I'm just going to touch a little bit on Indigenous or Aboriginal peoples in this country. This may be very familiar to you, so I'll just ask for patience, but I will cover it briefly with a slight nuance and an explanation of where I'm coming from. So the three circles that you're seeing represent the three Indigenous or Aboriginal groups. My preference for term is Indigenous, but both are accepted in most circles. The first one is the medicine wheel, which is comprised of the four components, and that typically represents First Nations. It's not representative of all First Nations, but it is generalized and usually encompasses that group. The middle circle is represented by the infinity symbol, represents Métis, and that's my perspective and background. And the third circle represents Inuit through the Inukshuk. I will be transparent. I have more familiarity with First Nations worldviews and understandings. I'm coming to you today from a perspective of Métis, and so that's the perspective that I'm bringing. And I have little understanding and little exposure and experience to Inuit. So I don't bring much authority or expertise in that area. And the other component I wanted to talk about on this slide is there is great variance even within these groups. So although Métis is sometimes presented as a homogenized group that's comprised of people in Western Canada that enters into Ontario, there's great variance within these groups. And even with my own family, there's great variance in terms of people's beliefs, spirituality, how they look and appear, how much meaningfulness the identity brings. And similarly for First Nations groups, there is a huge variety across this country of First Nations peoples, their beliefs, their practices. So that's the emphasis I want to provide. And then I'll also take a moment just to reinforce that I'm bringing to you today a perspective that I consider a Métis perspective, which is a blend of theory, practicality, storytelling, and all which will contribute to an academic discourse. And also, I quite like this picture. This is a representative of my family as well. These are both stylized, photographs. The first one is a wagon wheel that represents my settler ancestry. That's my grandfather's wagon that he used on his farm in Saskatchewan. And the picture to the side of it is a teepee poles without the teepee tarp around it that my family and I use in my backyard. But I like the spokes symmetry that they both share. Design similarity. And I think it speaks to the hybridity. There is reciprocity and hybridity in Indigenous health and healthcare systems that's needed in this country, meaning that we can benefit from having different perspectives or merged perspectives. And one of the components to that I think is quite useful is two-eyed seeing. And two-eyed seeing is a guiding principle that encourages individuals to view the world through both Indigenous and Western perspectives. Two-eyed seeing came from Albert and Mardina Marshall, and they are First Nations people from the east coast of Canada. And my understanding is this perspective came from science courses that they were teaching. And the idea is that Western perspectives predominate the scientific community, and the students were all learning science from Western perspective, which breaks things down, which individualizes things, which separates components into individual parts and breaking down of systems. And the comparison you can use is Indigenous perspectives often look at systemic wholeness, where the system all functions together, and community and all of the aspects combined to make a greater whole or a stronger whole. And so the idea of hybridity is the blending of worldviews. Both perspectives are of equal merit. Indigenous and non-Indigenous or Western perspectives can both be seen with equal value and bring an added value to systems that we have. And that hasn't necessarily always been the case. And often Western perspectives have been presented as of greater value, of greater worth, and have been prioritized in terms of people's learning. So reciprocity and reconciliation, both are important aspects to the work that I'm doing. And reciprocity means recognizing and valuing Indigenous knowledge and practices and creating space for Indigenous peoples to share their knowledge and experiences. And reconciliation is the process of acknowledging and addressing historical injustices with the goal of forging a respectful and equitable relationship. And why is reconciliation needed? I'm going to share with you a powerful story that I learned, and I think it's very illustrative of where we've come from and the impacts that that has had and where we can go. And so this talk is named The Doctor's Bag and the Medicine Pouch. A powerful story was shared with me regarding treaty signing several years ago, generations ago, when treaty was first enacted in this area. And the story that I'm sharing is actually a real story from one of the First Nations treaty signings along the James Bay coast. And contrary to popular belief that that all Indigenous people were taken advantage of or didn't know what they were entering into, or were asked to sign an X and they didn't know what that meant, this First Nation community understood what the potential could be and were actually excited for treaty signing. And they thought that there would be a great benefit that First Nations would have the best of both worlds. They would benefit from their own culture as well as the culture that had established from a Western perspective. And so they asked to see the doctor's bag, and elders and knowledge holders examined this bag and blessed it, and were excited to think that not only would their people benefit from traditional medicine as represented by the medicine pouch, but they'd also benefit from Western medicine and the health benefits that that has. And so they were excited, but the reality and the sad outcome is that promise did not materialize. And the system failed to incorporate the medicine bundle while also falling short of fulfilling the promise of the doctor's bag. And there's missed opportunities and a failure to uphold these commitments. And it lays the groundwork for the need to set out on a different path, one that addresses the historical and ongoing challenges faced by the Indigenous peoples in Canada. It's also important to note that in establishing healthcare services, including mental health, Indigenous people did not have an opportunity to inform or approve the systems that were put in place. And the result has been that there is a huge health discrepancy in this country. And the social determinants of health are a big part of that. Social determinants of health are made up of social, economic, and cultural, environmental aspects of health. And the reality in this country today is that for Canada overall, we rank quite high in terms of where we sit amongst first world countries in terms of health outcomes. We are a first world country with a good healthcare system, and for the most part, we generally have good healthcare outcomes in compared to other first world countries. If you separate out Indigenous people in this country, the healthcare outcomes are comparable to third world countries, which is really unfortunate and needs to change. And the reality is improving healthcare for Indigenous people will improve and add to a greater strength for ourselves as a country as a whole. But I also believe that Indigenous healing practices that have been effective over millennia will add to the value for healthcare system in Canada overall for everyone. And that brings me to some of the research that I'm doing in terms of the PhD studies and why this is important to me and how it kind of came about. So as I was preparing and doing my coursework for PhD and thinking quite a bit about what it is that I want to touch on, what do I want to speak on, what do I want to research, I ended up reading a story about buffalo in Saskatchewan that were put back into a grazing pasture, traditional grounds that had never been broken up by the plow. And these buffalo were engaged in a buffalo wallow, which is a traditional practice in which buffalo roll around on their back and they itch themselves and they get rid of mites by rolling in the dust. And what ended up happening was they unearthed petroglyphs. And this picture here is a cut stone that an Indigenous person over 3,000 years ago carved pictures and representations of buffalo into a rock. And that was quite meaningful, both practically as a hunting ground and spiritually, to represent the importance that buffalo has. And I ended up having a dream on that shortly after that talked about the importance of cutting buffalo meat and how that would be beneficial both for myself personally and also that dream informed the work that I'm doing. And I spent some time reflecting on what this all means. And I engaged in a fast and used that teepee that I shared earlier to spend 3 days reflecting on that work. And that was followed up by a sweat lodge in which I talked to a traditional elder and engaged in that practice. And that's all informed my research. And that also really helped me think about the importance of bison in my life. And in times past, in times of hardship, I've drawn upon buffalo teachings and getting through tough times or going through a storm metaphorically. And the idea came to me of using buffalo methodology in terms of a metaphor for both Indigenous and non-Indigenous to understand these concepts better. And the idea came to me of cutting off of buffalo meat can be similar to breaking down concepts or ideas and using the metaphors to understand ideas like reciprocity and reconciliation and two-eyed seeing and breaking it down for people to understand better. And that has led to a bison approach or bison framework or methodology for mental health services that I'm developing through my PhD studies and using the idea of that buffalo's metaphor, both in past, present, and future, to help guide the work. And what is it that that would be useful, or what is it that could be helpful for people to understand? And you illustrating both Western and Indigenous approaches to mental health as a framework, incorporating both. So again, drawing upon from my heritage as Métis, trying to walk with a foot in both worlds to benefit the everyone who is interested in learning more about this. And so I believe that this has been really helpful for me in the work that I do and the education that I'm involved in. And what I mean is I see it as a virtuous circle. The education that I'm doing, both the learning and talking to people and the reading and other experiences that I've had inform the work that I do as a director in mental health and trying to facilitate change in that way. But at the same time, the work that I'm doing and the people that I'm meeting and the experiential healing practices that I'm taking part in also inform the work that I'm doing as research. And then this is also has also taken a component of being able to inform CMHA at a national level and the work that they're doing. And so I mentioned about the importance of community engagements and how meaningful that is to the work that I'm doing. And it is vitally important. It's respectfully engaging Indigenous communities into an approach where we can sit in a circle and learn more about what they believe is important, what they would like to see in their own experiences around mental health. And In addition to that, there's been a number of approaches that I've introduced and been part of at my organization to look at Indigenous approaches, or to try and indigenize mental health services at our branch. And some of those include forming an Indigenous committee. We looked at and asked the question of what does reconciliation mean for us? We really reflected on the practices that we do and ourselves as an organization. We asked the question, and I mentioned there's a number of Indigenous communities that surround us, but in all reality, even though there are substantial mental health and addictions challenges in those communities, we weren't seeing people come through our doors in the numbers that you would imagine. So we had to ask ourselves, why is that? Are we not seen as a trusted service provider? Are we not, our service is not well known enough? An example that was provided back to us is even amongst Indigenous communities, it was described that stigma exists there even to a greater level than general population. So when it says mental health written in big bold letters above the door, it's hard to pretend that you're going into that agency for anything else other than mental health or addiction services. We really focused on trust and respect, including the expression that I really like that was presented to me. It's often fostered over 100 cups of tea. So you can't rush respect and trust fostering, and it often needs to be done on a one-on-one level or an individual level. We developed a strategic plan at our organization that focused on goose teachings as a metaphor, similar to the buffalo one that I described to you, that was really meaningful to both Indigenous and non-Indigenous as a way to really make the work meaningful. And in many cases, the feedback we received is that a lot of times strategic plans are great and you are excited for the process, and then they get tucked away into a drawer or tacked up on a wall, never to be looked at or thought about again. But the goose teachings that inform the strategic plan really seemed to resonate with people and made it last a lot longer, that it wasn't simply just one and done or tucked away after introduced. Looking at what we wanted to do in terms of priorities and developing an action plan, we did an on-the-land gathering, which involved traditional practices, and worked with partners in our community that are Indigenous service providers themselves to help facilitate this. And we sat in a circle and had people talk about what's important. And that seemed very meaningful. And it was a different perspective. It was a different mindset than sitting around a boardroom or tables. It was on the land gathering. Another important approach that was very useful and meaningful for us is hiring an Indigenous liaison. We engaged a person who is well known and respected in the community, someone who is a knowledge holder and was involved and excited about the transformation that we were embarking upon. And she has done an amazing job at working with our teams, working different approaches in our organization, working at different levels to help, from different things like in doing healing circles, to sitting with people to develop land acknowledgements, to introducing us to different organizations in the community, and to learn more about the history and her culture that's local to us. So we paired this local culture with what I describe as more global Indigenous knowledge. We have cultural competency for all of our staff, and I mean all of our staff. If you work at reception, you work in IT, you do direct service, you're a psychiatrist, everyone's expected to complete the Sanya's cultural competency training that we provide. And I think that is a great overview of the history and a global culture of Indigenous background and history in relation to Canada. And then we try and pair that with local practices as well. Another area that we focused on is creating safer spaces. And that started with pairing the cultural competency that we have, so people all have a basis of understanding, with trying to change the physical environment, including putting up murals that come from a local Indigenous artist that we have in Timmins, with trying to put up different artwork, different design elements that reflect the area that we live in, because there is a predominant Indigenous group and peoples that reside in this area and it is their traditional territories, and trying to work at a level that doesn't come off as just window dressing or a false promise. We're trying to develop so people do have a competency and a capacity should an Indigenous person come through the doors and need to access service. Areas that we are still working on is trying to increase the recruitment and retention for Indigenous people to become our staff. That is an area that we're trying to focus on and develop the capacity so when those staff come on board, they feel safe and secure and supported in their role as well. A couple more that I can touch on is just like you're hearing today, we too brought in guest speakers to talk about approaches. One that was not Indigenous herself, but she was involved in the why am I drawing a blank? Sorry. Desegregation movement in the United States, but she also spent a time living in our area. It was Minnie Jean Tricky and talking about having the comfort and boldness to make transformational change and the importance of working towards societal change. Some of the experiential education has been vitally important. I'm not sure if any of you are familiar with Kairos blanket exercises, but we've committed to doing those at each area or district that our services are provided in, so staff and community members can take advantage of learning the history of this country from an experiential perspective. And another one that was important, I mentioned Sweat Lodge. I was very grateful and appreciative that we were able to take part in a local sweat lodge that one of the communities was putting on, and senior leadership from my organization was invited to attend that. So this really helped people who were maybe not familiar with these practices come to understand the power of Indigenous healing and experiences and traditions and culture at a very profound level. And that was a really transformational moment in this organization's history, because it really you can gain a lot from book learning, and I'm not downplaying any of that at all. When you do experience things at a level of participation and the traditional practices and the components that are involved in experiential learning, it can be quite profound, and did in fact make a profound difference. But not everything has been sunshine and roses, and not everything goes smoothly. That is just the reality of change management. I'll just take a moment to explain if it's not clear. This picture is a stylized version of a well-known photograph near an area where I come from. This is a pile of buffalo skulls that was, before Regina, Saskatchewan got its name, it was known as Pile of Bones, because they wiped the prairie buffalo off the map. So if you couldn't tell, that's what this picture is. And I like that because there is a number of setbacks that have happened in terms of the path that this organization's on in terms of transformation. And that includes Indigenous specific racism that we've had to address, impatience with the time frames that sometimes fostering trust and working towards change can take, living in areas where there are significant challenges. Timmins right now is struggling with significant homelessness challenges, and the homeless predominantly are Indigenous that come from coastal communities that tend to end up in Timmins. All of our communities are facing an opioid crisis, and that includes Indigenous people. The challenges that people often see are often Indigenous faces, meaning they're in the community. They are people that are struggling. Other areas that we have challenges is, how do you mark success? For Indigenous thinking and worldviews, that often means starting now, so 7 generations down the line will benefit from changes that we're making today. The world that I work in, the business world, is looking at next quarter, having markers of success that what's happening now, what are we doing 3 months from now, 6 months to now, and how are we marking success, and trying to find ways to pair those two different perspectives to still proceed in a meaningful way. A couple others that I'll touch on is one I like to call is whataboutism. And when I speak at tables, and I often highlight the need for an understanding around Indigenous perspectives and the challenges that are happening, I often get faced with, well, yes, Tyler, that's important, but what about LGBTQ2S+? What about Francophone? What about marginalized populations or new to Canada Canadians? And I will agree, all of those are important, but the challenge that I find is often those are raised and nothing done about it. They're just raised to say, well, what about this? What about that? And it derails the conversation. And another one that I also like to talk about is what I describe as benign neglect, or what you might understand as polite racism. These things don't always happen in a ugly, overtly racist way. Sometimes you can find ways to turn people away, or find ways to not provide services, or find excuses. And the one that I always talk about is one that was a reality. It was posed to me as, why should CMHA change? We know those people want their own services, and they'd be better off with their own services. And I wouldn't necessarily disagree if we had a robust, very effective, very meaningful Indigenous service system for mental health care in this country. But the reality is we don't. And my perspective is CMHA has an obligation to provide services for all the members of our community, and that includes Indigenous. So we should learn more about it and take that as part of our obligation to healthcare in this country. And thankfully, many people agree. I am going to wind down here because I know I do want to save some time for questions. And so a couple more slides. One is looking at a strength-based approach. So I already talked about Indigenous and non-Indigenous perspectives, or having a foot in two different worlds. There's also different perspectives on healthcare and health practices. And often what that boils down to is, for non-Indigenous or Western-based mental health care or healthcare, it's a focus on symptomology. It's a disease-based model of care, where you talk about the problems that you have, the symptoms that you're having, the deficits that you bring. You could consider Indigenous worldviews of mental health care as trying to seek balance, and it's through a healing journey. So it's often a strength-based approach. It's what are you working on? How are you trying to seek balance, for example, through a medicine wheel framework of mental health care. And I like to also highlight resilience. We often think about Indigenous experience in this country, and we talk about intergenerational trauma, which is really important to understand and consider. But I like to pair that, and it was important teaching for me and learning for me, is we also have intergenerational resilience, that people in this country survived, and in some cases are thriving, and ancestors and people that we are descended from had a resilience, got through what needed to get through. They survived, and it may not have been pleasant, and in many cases it was traumatic, but those resilient attributes still exist and should be honored and respected. And looking at a strength-based, but also including community. Community is often very important to Indigenous mental health perspectives of healing, as is taking a holistic approach. And along those same lines, and tying it all together, is people often ask me to give these talks, are you hopeful for the future? And I genuinely am. And I don't think that this path is going to be easy, and I think it's going to come with many challenges and some setbacks. And at different times, there is more receptivity to moving forward with Indigenous perspectives, and sometimes there's backlashes. But I believe that we're at a key junction here, where in particular young people do have respect and an appreciation for Indigenous worldviews. When I was growing up, it wasn't necessarily proud to be to have an Indigenous background, and it wasn't seen as having worth or something to be celebrated. When I talk to young people now, I get a different perspective, that they're proud of where they come from. They want to make change. And I think there are pockets and other portions of society that agree with that sentiment. And so I think that hope is imperative. It is required for the tough times that are ahead, but also it seems to be a time when the hope is more close to the surface, and we can capitalize on that. I shared with Taryn some resources that you're welcome to look at and consider and reflect upon. The first one is quite a intense article, an in-depth article talking about decolonization, not as a metaphor. If you're not familiar with it, it's from Tuck and Yang. It may be something you want to look at. Another one that I quite liked is Kathy Absalon and Indigenizing Social Work, or Indigenizing Elements of Social Work, that I found quite instructive and useful. And then I touched on it earlier, but Marshall's concept of two-eyed seeing is something that's really gaining ground and being utilized across the country and in different institutions and different systems to try and weave together and talk about all these concepts that I've brought to you today. And so I will just talk about some of the things that I hope I was able to emphasize today. The importance of community engagement, and how I think that will become a really profound practice for ourselves as institutions in this country. I think reciprocity is a compelling element that really will work to benefit ourselves as a country, so we can understand at a deeper level, and through that also improve the healthcare outcomes for Indigenous people in this country. And the last one that I just touched on is, I really do think this is a hopeful and optimistic time. I think the groundwork has been laid. We have an opportunity to make transformational change in this country and improve ourselves, Indigenous and non-Indigenous alike. I'm standing at a workstation, so what I'm going to do is stop sharing my screen, sit down at a chair to join you in a question and answer period, and maybe take a drink of water because I've been talking a lot. So I will just say thank you very much again for allowing me to present to you all today. I consider it an honor. Thank you, Taryn, for all the work that you've done in advance. She and I have had several conversations to try and land on what I hope was some areas that you were interested in, and I touched on topics that I hope were relevant. So I will see you in 3 seconds.
Thank you so much, Tyler. If folks would like, you can start submitting questions in our Q&A section at the bottom of the page. And in the meantime, maybe I can ask something from you, Tyler. So again, great presentation. These are things that we don't really talk about often, which is quite the shame. And I believe that, the more awareness that it's brought to, then the better that we are able to navigate some of these situations and broaden our approaches. So I guess here's my first question to you, Tyler. What specific instances would some of these approaches be beneficial for post-secondary students if, staff are unable to identify ways to incorporate them, or they're unsure?
I think a couple of ones that I found profoundly meaningful, and I touched on it a bit earlier. I'm not downplaying presentations like today, or articles that I've shared, or books and learning that you get that way. Those have been very helpful for me in my own understanding. But the areas and instances in my life that have been truly profound have come from experiential learning. So if you have an opportunity to try and take, and sometimes it involves getting out of your comfort zone, and sometimes it takes reaching out, and sometimes it takes being rejected, but reaching out to local Indigenous communities to try and find out more. Sweat Lodge is a big one that's often involves some practice and preparation, and it involves gift giving and reciprocity. But there are other areas, some things that I regretfully am not taking part in, but I know people are to great success and to deep meaning, is language acquisition and fostering language acquisition. So traditional Indigenous languages, what's the language that was spoken in your area? Is there an opportunity to incorporate that across your school setting or workplace setting? The Indigenous committee that we formed is comprised of a number of people, so it isn't predominantly admin or leadership. It's direct service staff that are involved in that, and that can be useful as well, because that can touch on decision making or focusing on areas that are meaningful to the staff and the day-to-day work that they do.
Thank you. I'm just noticing a lot of questions coming in, so
Okay.
let's get started. So we have a question here that's asking any ideas on maintaining the momentum of a strength-based approach, as I find the brain's innate default to be problem-based indicating system that seems to return to this default.
That is such a great and important question. I think it goes back to that resilience. I think it's making a conscientious effort to try and shift your perspective, because whoever asked the question is completely correct. Our system is called healthcare, but if it was more accurate, it would probably be called disease management in this country, because it is based on a model of disease care, symptomology, and it's presented as people don't go in for help unless they are having a problem, which is inherently problem-based or deficit-based. So how do we shift that? And I think it is moving towards healthcare. One of the reasons why I believe that we can all benefit from Indigenous perspectives on healing, because it is a healing journey based on trying to attain balance. So no one in this country has perfect health care, physical or mental. So what does balance mean for you? What does it mean for me? And it helps individualize it. The biggest takeaway is I don't have a great answer for that, other than resilience, persistence, diligence, stubbornness, trying to bring that to people's attention, trying to influence people that have the ability to make change. And if we're all working in the same direction, then I think systemic level change will happen. Oh, one other area to that, sorry. In our area, there's the Northern Ontario School of Medicine, in which all of the students who are becoming physicians are obligated to learn about and also do an internship with an Indigenous community. And I think things like that are very meaningful and will foster change.
Very well answered. We have a question here and also a comment. Thank you for taking the time to share these wise words with us today, Tyler. I took a lot of notes, which I will go back to review. I love the artwork that you featured in your slides. Who is the artist or artists that you featured in your presentation?
Yeah, the artwork that comes from are predominantly my own photographs that I ran through a art program that stylizes them in the way that you saw. And I'm just trying to reflect on what it's called. Paint with 2 T's. So I know there's Word Paint or Microsoft Paint, but the program that I used is PAINTT, and you can take a photograph and real stylize it. They're predominantly my own. I have grabbed a couple off of the web, including the buffalo skull one. But thank you very much. I like the artwork as well, and I think it reflects my own background and seems to be useful for people to understand the concepts. And sorry, can you go back? Was there a question as well?
That was the main question. I
Oh,
do
that
have another
okay, yeah.
question. Yeah, so somebody else is asking, can you speak a little more about the goose teachings?
Yeah, so like buffalo, goose has also been very meaningful in my own life at times. When I had to leave the farm in Saskatchewan, we actually lost the farm. And at that time, the sky filled with more geese than I'd ever seen in my life, which was a huge moment and profound. There was other moments in my life with my mom's passing where geese were present as well. Um, so when we were sitting down and I myself was sitting down to reflect on what would be useful for a strategic plan for our organization, and is there an opportunity to try and indigenize elements of that? Sure enough, geese were honking in the background as I sat down at my workstation to do that. And the thought came to me, and I reflected on different goose teachings, like for example, one of the ones is you're never alone. If a goose is injured or unable to fly, two geese accompany that goose down to the ground and stay with that goose until it can rejoin the V formation, or it can't, but it's never alone, even in its final moments. So when we're providing healthcare and care for our community, that's a great lesson to draw upon. None of us are ever alone and should be, and we have an obligation to provide healthcare. So that is an example of incorporating that into the strategic plan. And there's a number of elements as well. And Taryn, if you're if anyone's interested, I can share that strategic plan for people to have a review of and a reflection of. And before I forget to, Taryn does have my email address. You're more than welcome to reach out to me if there's questions, thoughts, or comments you have after. I'll just request patience. I am going to be going away to a conference, and I do have a lot on my plate right now. So if I don't answer you right away, please just have patience. I'll try and get to all the questions over time.
Thanks so much, Tyler. And yes, Tyler's information will be available on our website, as well as the resources that he has sent over to me. We have another question asking about two-eyed seeing. So using the perspective of two-eyed seeing, how do you envision preventative approaches to health and healing?
So I think two-eyed seeing is really gaining momentum in this country because people are interested in learning more. For generations, Indigenous perspectives have been buried and, in fact, outlawed in some cases, and always seen as of lesser worth and value. And that's shifting and changing, and people are becoming more interested to learn, like our discussion today. How it can be brought towards health and healing, I think, is recognizing that, recognizing the history that we all come from a system of learning and education that has predominantly put Western-based, English-speaking perspectives at the top of the pinnacle, meaning that there's a pyramid that at the top is the system that I just described. I think stepping away from that and viewing things as of greater worth or value in terms of a worldview system, it can be really effective to a systems level, whether it's education or healthcare or other systems as well. And I look at it, and this is outside of a little bit outside of two-eyed seeing, but it really relates. And it's this idea that if someone comes in for healing services or healthcare or mental health services, and they believe that they have a mental health issue like depression, and they focus on their depressive symptoms, and they talk about the experience that they believe contributed to depression, and they talk about their pills and medication and how those are effective or not. That is that person's reality. Someone else may come in and talk about they're out of balance and they're struggling and they're not fitting into their community, and spiritually they've been struggling and they haven't been practicing their daily uh, smudges or practices along those lines. Those two perspectives are of equal value and equal worth. They don't need to be mutually exclusive. They can both fit within a system. It's just coming to understand how do we support people and ourselves and develop a system that fosters that and allows for that.
Another question that we have here is, have you considered legal or other approaches to opening up traditional healing practices and medicines for Indigenous peoples?
I'm not sure I understand the question. Is it like having people sign waivers because there could be a risk to self or others, or with having people engaged in that?
I'm not really sure. My understanding, and the person who submitted the question, feel free uh, to let us know if you're getting this right. But my understanding is whether if there's a legal approach to embedding some of these services for Indigenous peoples, so that they're part of the system.
Um, so I'll share my own experience and then where I also want to get to. My own experiences right now in partnering with Indigenous service providers and letting people know different practices that are going on, encouraging people to go to powwow, encouraging people to go to sweat lodge. That's all voluntary practices. But where I'd like to get to is actually embedding these practices within our model of service. But again, at that same time, it will still be voluntary. You would select from a menu of services an Indigenous perspective or Indigenous model. So people would be going in with their own capacity to make that decision and self-select to attend. In terms of some different legal aspects, I look at it like we have an active recovery program where people engage in physical exertion. So at the same in the same way, if they're engaging in something that might be strenuous and they have diabetes, for example, then they are informed on the impacts that could have on their physical health and exertion and what to watch out for and supports to be put into place. Hope that answers the question. I'm not sure I fully understood it, but that's the perspective that that I interpret it as. So if I didn't touch on the mark, please let us know in the Q&A.
Thanks so much. I just noticed there was a hand raised by Rebecca. If you'd like, Rebecca, you're welcome to either post a question by unmuting or putting it in the chat. If it was a mistake, no worries at all. In the meantime, there's another question here. If you could choose 1 to 3 areas that post-secondary institutions need to focus more on to improve Indigenous student mental health and well-being, what would those areas be?
From my own bias and perspective, it was profoundly meaningful for me in my own life to be introduced to experiential learning and experience culture from a very respectful and from Indigenous service providers, or well, that's not true, they weren't service providers, Indigenous people that were sharing culture. So that would be my number one. I think the second one would be fostering of champions. So there is a great appetite to learn more, much like the questions that are coming today. And the sad reality is there's not enough people in this country that have an area of authority or expertise to talk on things. The culture was decimated and we're trying to rebuild and pick up the pieces. So if we can foster champions, people that are very interested, that want to increase the knowledge and understanding, but also have some of the background and information to do so, that would be a great addition to our country as well. The sad reality is I'm doing a PhD and I had to go outside my Queen's University so I could have an all Indigenous PhD thesis committee because there isn't enough Indigenous academics in this country. And then another area that might be useful is the related to the Indigenous Committee is maybe look to have your institution tie some of these understandings and goals to an equity framework. Is there a plan that you have over 5 years to increase your understanding at your institution, increase your approaches, or bring in traditional healing, any of those things? Could you tie it to an equity framework that makes sure that leadership in the organization is interested and understands what that is and is on board?
I have another question with a comment here. I resonate so strongly with the shortcoming in our healthcare system as a disease management system. I saw on television that there's a hospital in Toronto that has an Indigenous healing center, including an Indigenous elder. I believe the entire hospital could benefit from the integration of this support for all patients. I would be delighted if I was offered this holistic support if I was in a hospital. Do you see CMHA including Indigenous informed mental health supports for Indigenous clients, example, land-based sessions or meetings as you spoke of, for Indigenous clients and all clients? Two-eyed seeing approach for all clients would benefit all, I believe.
Great question, and actually very timely for me. Thank you, whoever put that out. I do think that we have an opportunity. I am going to be taking a 3-year secondment where I'm stepping out of my role of director at CMHA, and I'm going to become a lead manager for Indigenous wellness and reconciliation with CMHA National. CMHA National is very interested in the conversations that we're having today and looking to reconcile their history, the approaches that have been taken, and to learn more, and then to see what we can provide as a CMHA, both in terms of education, fostering support, and practices in this country. So I do hope so. I am going to actually have a seat at the table to help direct some of those conversations. So yeah, yes, the answer is yes, and I hope we get there, and I'm going to work very diligently to try and ensure that we do.
Amazing. So we're coming towards the end. I do want to share a comment that was shared. This was an excellent presentation. Thank you for sharing. I don't have a question, just a comment that I particularly enjoyed the concepts of a strength-based approach and two-eyed seeing to move forward. I think that is one of the best ways to effectively indigenize educational institutions. So I completely agree. Thank you so much, Tyler, for having this wonderful presentation and having this discussion with us. Folks, I want to remind you that our next webinar will be held December 15th. We'll be talking about the Thriving Classrooms Toolkit and how classrooms can be a great way to start thinking about how to support students and faculty, their mental well-being. We also want to encourage folks to check out our website, campusmentalhealth.ca, as well as our More Feet on the Ground course. And I also want to remind folks that we do have an archived webinar section. So all our past webinars are recorded and are on the website. So feel free to check that out. And finally, I want to remind folks that we will ask for feedback on this session. The post-webinar survey will be sent out as soon as this webinar ends. Again, thank you so much, Tyler. This was, again, such a very great session. And I hope all of you have a wonderful weekend going ahead.
Yeah, thank you so much. It was an honor for me to be here. I really appreciate getting a chance to talk to people about this area that I'm very passionate about. And thank you for the invitation. Thank you for all the support, Taryn. And yeah, everyone, have a great weekend. I hope the weather's nice, and I hope you get outside.
Yeah, goodbye.